Well, I am Dr. Vinod Kumar. I'm interested in the care and welfare of senior citizens. Today we will be talking about the how to look for and care for the sick and elderly persons. We already know that there is a huge population of elderly persons that's above the age of 60 in our country, and millions of them are suffering from a variety of chronic, lifelong, sometimes life threatening diseases. And sooner or later, many of these people become partially or totally dependent on the family members or on their dear and near ones. There are many people in this age group who also live alone, who are bedridden, and unfortunately, there is not much sensitization about their plight from the point of view of care and help that they should receive, at least in the medical community. Although I think there is a lot of information available for paramedical community, many of whom are the primary caregivers apart from their own family members for looking after the elderly people. So today we would be discussing the subject of care of sick and elderly people, and I would proceed by sharing the slide first. So I think you can see this first slide on the screen, and I would put it on full screen for easy viewability. And here we go. So this is the subject I was talking about. I think it is a common knowledge that elderly persons can become partly or totally dependent on their caregivers because of a variety of limitations in their many day-to-day activities like mobility, memory problem, or difficulty in bathing by themselves, or visual or hearing impairment. They cannot dress themselves. They have difficulty in climbing stairs. They have difficulty in proceeding to toilet, finding the toilet, sitting on the commode, and sometimes they lose their balance and they may even fall down. And in some cases, they are not even able to eat themselves. So these are some of the handicaps that we come across as the people age more and more. Now, this dependence increases further as old people may also face a following adverse situations in life from time to time, like age discrimination. I think society at a large has some component of discriminating against the age of the person, sometimes leading to even neglect. Then, as he is aging, becoming elderly individual, he is faced with bereavements. He may lose spouse and other near and dear ones. Of course, I've already discussed about chronic disease that may have depression, emotional disorders of various kinds, mood swings. Then they have a problem of falling income and status, and sometimes they have fear of death, fear of unknown or fear of death. Generational disconnect, they have do not have much interaction with the second generation, at least like their grandchildren in the modern times. And because of the declining immunity, they have impaired power of healing anything they get, and they have difficulty in coping with any kind of psychological stress, or meaning thereby they are less resilient as they used to be in their young age. And of course, very importantly, they are often isolated and lead a lonely life. Now, the caregiver may face more strain in looking after such elderly people if such people have medical disorders and also normal aging symptoms, which I have enumerated alphabetically here. Of course, the list is no complete by any means. So disorders are given on the left side and the aging symptoms on the right side, like aches and pains, cough and breathing problem, constipation, diminishing appetite, feeling fatigued and exhausted, and hardly doing any physical activity. They appear to be forgetful in their old age. They have difficulty about their teeth and gums and chewing the food. And of course, they are often impaired from hearing and vision point of view. And many of them have insomnia, that is, difficulty in sleep and they also may have incontinence. That means they are leaking urine or feces sometimes. So, with so many difficulties becoming a part of life of some elderly person, it seems no other age group is so vulnerable to such multitude of physical, mental, social, and financial problems as to often require a multidimensional support eco-care system based on strong ethical and legal principles. So, what are the principles of ethical care given? Ethical care comprises moral, spiritual, cultural, and economic rules of etiquette which must be adopted by the caregiver to regulate his or her own conduct while giving care or looking after such a patient. Ethical principles are at times, however, neglected or they come in conflict with medical decisions, and consequently, ethical obligations are now heavily supplemented by and intertwined with health laws, but they should still exceed legal rights. Now, geriatric caregiving, that is caregiving to elderly people, is of two types. It is more commonly a selfless caring by the family member, but there is also an emergence of profit-making industry in this field. Selfless family members are the largest resource as informal caregivers, and definitely they lessen demands on healthcare system of the government. Friends and neighbors can also pitch in for this job. Since caregivers suffer from fatigue, stress, and personal disruptions by sustained caregiving duties, government subsidies, tax incentives, long-term care insurance, and respite care are to be widely available for support to caregivers. Increasing modernization of our life with dwindling supply of informal caregivers who are often doing their own jobs has triggered formal private caregiving as a thriving industry where compliance with ethical and legal provisions to avoid misconduct, negligence, and financial exploitation are at times a big issue. So care receiving, we have heard a lot about care receiving by aged people. There are plenty of national programs, there are plenty of legal protections and ethical obligations I talked about. But what about caregiving? Are there matching resources and facilities for caregivers? So there are lots of national programs, as I said. I'm not going to enumerate one by one, but I think it's a busy slide. Mostly they are floated by either Ministry of Social Justice, which is the nodal ministry for elderly people, or by Health Ministry, but other ministries and departments are also involved. But I think there are certain well laid down policy and laws also. Directive principles in our constitution of stated policy, Article 41 mentions that there is a bound and duty of the government in capacity of its economic powers to extend help and support to elderly people. The Hindu Adoption and Maintenance Act, promulgated in 1956, also mandates looking after the parents by the children. Himachal Pradesh Maintenance and Parents and Dependents Act, which came in 2001, also showers responsibility for looking after spouse, children, and parents. And of course, there is a flagship, more recent act, which is called Maintenance and Welfare of Parents Senior Citizens Act, came in 2007. This also mandates not only the looking after and maintaining their parents, but also gives them punishment if they do not do it, or they abandon the parents, or they usurp their property, and so on. So these are the well-known principles of medical ethics, which should be observed both for the people whom we are caring and also for the caregivers who are caring for them. Autonomy, beneficence, non-maleficence, dignity, justice, and honesty, and I will describe them briefly. Now, these are the principles I enumerated. Autonomy means the patient has a right to refuse or choose his treatment. Caregiver has a right to lessen the burden for getting his autonomy. Beneficence, no, the action is on the best interest of the patient, also for the overburdened caregiver. Non-maleficence means minimizing the harm to the patient during caregiving, and the same applies to the caregiver during his caregiving duties. Dignity means both patient and the caregiver have the right to dignity, however they may be marginalized, ill, or compromised. Justice is human rights and proper access to health care by the patient and reducing the caregiver burden for the family care especially is also justice. Honesty is truthfulness and concept of informal consent. Now, these ethical and legal applications apply to so many dimensions and settings wherever the care is given to these people. This could be either basic care, often given in home care. Other is a home care where even advanced care can be given. Then there is a domain, what is called advanced care, hospice care, institutional care, palliative care, that is at the end of life, hospice care, and hospital care, and terminal care. Now, basic care tasks which a caregiver has to observe while providing duties to look after his elderly client or his elderly dear and near one. Wellness, hygiene, and accessories. Wellness could be as simple as giving company to the elderly, homemaking, giving him dressing, counseling and assuring, entertaining, helping in mobility, feeding, giving him proper diet, managing in drugs, promoting his exercise, giving him basic physiotherapy, and monitoring his vitals like pulse, blood pressure, etc. Hygiene could be oral hygiene, brushing, shaving, bathing, nails, feet, hair care, bowel care, eyes, ear, and nose cleaning, toileting, hand hygiene, etc. And accessories, dentures, hearing aids, glasses, bedpans, footwear, urinals, diapers, weighing machine, and checking vision and weight, and so on. It must be remembered that caregiving requires medical service as and when needed. Advanced care tasks are little advanced, as the name suggests, like giving insulin injections, medicines of various kinds, relieving pain if it is there, and observing drug-drug reactions and adverse drug reactions, handling glucometer, nebulizer, managing the sleep of the patient, giving speech therapy when it is needed, assessing overall the geriatric condition of the individual, communicating at the right time with doctors and nurses, preventing falls, disposing the biomedical waste, tube feeding, artificial hydration, catheter care, caring for bed sores, wound care, dialysis care, and caring for specific diseases, and care of the bedridden, and whenever necessary, giving first aid or cardiopulmonary resuscitation. Advanced care applies to all the remaining settings of care: home, hospital, institutional, palliative, hospice, terminal, and end of life care, which I enumerated a short while ago. So, what are the characteristics required from a caregiver? Is a tall order, patience, sensitivity, dependability, emotional stability. The person has to be service oriented. He has to be dedicated towards his patient. And he has to, above all, observe the ethical values that I enumerated just now. So, in the bargain of caregiving, such a caregiver can face severe stress. Although caring for the loved one can be very rewarding, but there are side effects like added workload, household disruptions, job losses, financial pressure, changes in family dynamics, etc., and all being harbinger of stress. And when there is a stress, these are the signs: exhaustion, resentment, anxiety, depression, irritability, sleeplessness of the caregiver, worsening health, poor concentration. He starts drinking sometimes, smoking. He starts eating more because of stress, overreacts, helpless, neglects duties, and no time for his leisure, for himself. So, what are the tips for recharging the caregiver in such a precarious situation? He should speak up whenever the occasion arises. He should divide the responsibility, set up a regular reminder for his duties. He should say yes if there is a assistance offered from a non-traditional quarter. Make himself laugh and cut jokes, and he should get the habit of meditation. In between, whenever he gets time, he should get out of the house, share his feelings, emotions with others, should never compromise on his sleep, otherwise he'll be fatigued next day. He should join a support group if it is available, care about his diet, and undergo a checkup at regular intervals, and he should also resort to breathing exercises like pranayama. So, what are the common ethical questions which especially abound in the care of older patients? Is the patient able to provide informed consent for treatment? Is he capable of refusing treatment? If he cannot consent, who is to provide surrogate consent in his place? Is the patient to safe? Is the patient safe to live at home alone? Can he be left alone? Is the patient at risk of exploitation, neglect, and abuse? Can he continue to safely drive if it is still not too far? And what are the goals of care for a very sick and frail elderly? So specific and ethical legal obligations which must enumerate are rapid communication and art of listening to older persons when a caregiver is looking after such a person. Health-related human rights needs to be observed. Consent for admission and treatment is a lawful document. Advance directive and living will is also a legal instrument. And how to give end-of-life care, what we call as palliative care, when the disease cannot be cured, but we have to improve his quality of life for whatever remaining days that are left to him. And finally, handling property and financial transactions. Communication is an art. When you talk to an elderly person and you are caring for him, make an eye contact. Do not appear as if you are a casual worker. Listen to him always with a smiling face. Encourage older person to speak and honor his experience and listen. Do not speak too much. Let him speak more. And while he's listening to him, keep maintaining his individuality. He has his own life method. He has his own habits. So do not enforce anything on him which he may not like. Keep your own expression short, simple, and distinct. And there are, of course, special skills are needed for hearing, visual, or cognitive impaired, in which a caregiver has to be trained. Health-related human rights are not getting proper medicine, nutrition, healthcare. They get sometimes rough treatment, bullying attitude. They are discriminated simply because of their age, and sometimes they are hastily discharged from hospital. And dementia patients suffer more because they have memory problems. They are lying sometimes soaked in urine on bed, and whosoever is available to look after, he doesn't even respond. So these kinds of problems and violations do occur, and these are all health-related human rights. But older patients have the right to be protected under Maintenance and Welfare of Parents and Senior Citizens Act I refer to, and additional protection for them is also available for particularly dementia patients in Mental Health Care Act. Duty to provide and right to receive are to be replaced by responding to health needs of elder persons and realizing the health-related rights of older persons. This is a legal document as far as the consent for admission and treatment is concerned. If the individual and elderly person is incapable of giving informed consent, then a psychiatrist or a substitute has to confirm and certify based on the person's comprehension, understanding, and communication. And there is a document called Capacity Assessment Guidance Document issued by the Ministry of Health, for which a psychiatrist or a substitute can take the help and decide whether he can give a consent for admission and treatment, or a surrogate person is required for the same. Advanced directive and living will is important, particularly in Western countries. This is in vogue. Here also, the Supreme Court and other courts have taken cognizance of this necessity. Advanced directive is a document prescribing a person's wishes regarding the medical treatment that this person would like to have. If he is unable to share his wishes and not in position anymore to make a decision, its purpose is to promote autonomy and beneficence at a stage when he is already fully alert and conscious. So it is an advanced directive. Living will is one of the advanced directives, another being medical power of attorney, wherein a person can appoint an attorney in his lifetime when he is okay, and that attorney can then decide when he becomes sick and incapable. Palliative and end-of-life care is caring for an elderly patient for an incurable or terminal illness and is mainly aimed at improving the quality of life of the patient as well as his family who is caring, rather than aspiring for reversing or curing the disease. Palliative care obviously requires a whole team of experts, including psychiatrists, psychologists, social workers, priests, etc. Handling property and financial transaction is the last point. every elderly continues and should continue to have rights to own or inherit his property and distribute his financial affairs and to transact, sell or give the property according to his own will. He can ask for the limited guardianship from the concerned authority if he or she needs support in decision making. The clinician can be made to pitch in for the process if required. Finally, the writing a will under the Indian Succession Act requires a sound mind, and in case of doubt, a mental health expert advice may be needed. So I would end here by saying that care for those leaving this world is as much important as we care for those entering the world. I hope you like this video, and if you have liked, please share it further. Thank you very much.